And now we're going to move from using the technology for games and puzzles, which is low tech, to using technology to remove roadblocks for health literacy. Nrip is going to talk to us about high technology for promoting health literacy.
Very good afternoon to everyone. Those at the back, can you hear me? Fantastic. I'll keep this short. See, we've been talking about good things, we've been talking about bad things today. We've heard about some problems, we've heard about some solutions. There are some problems that I'd like to highlight before we start. One of the biggest problems with human beings is that we give up very easily. We try something, we don't see results, and then we just give up. Now, health literacy and health education is not a one-time endeavor. It's something which requires constant collaboration, constant engagement. If you want to connect with patients to support their role and responsibilities in healthcare, if you want the patients to engage with you, first you need to engage with them. And you should not be giving up when it is not working out at an early stage. Moving on. Suppose we look at a scenario. Now, this is a bleak scenario. What if we created tools to promote healthcare, to deliver healthcare, and to make sure that patients engage with us? But somehow, these tools were inaccessible to the majority of the population when they wanted it, when they needed it. It's not a very good situation. But that's exactly the situation that we are at right now. You see, doctors over the years have created some very excellent tools. Doctors are very learned people, they're intelligent people. They've created leaflets, they've created illustrations, and these leaflets and illustrations work. It's not that patients don't understand them. Most patients who go to a doctor who provides them with, a leaflet about angiography, the patient does seem to understand. And this information is made available to the patient. The only problem is the patient is not ready for this information when the doctor wants to provide it. The patients have their own, things to do in life. You might have a patient at a hospital. The hospital is providing lots and lots of leaflets. The patient takes the leaflets. There's a family member in the room, takes the leaflets down. Suddenly there's a phone call, like we're getting one right now. The patient, the family member takes the paper, starts, scribbling something down. Within about few hours, the paper is lost. The next day, the patient has no idea, what's going to happen because the papers are lost. Now, that's the thing. When we are offering information to a large population, one of the things to do is to go to the people where they are. You should be able to be willing to meet the people where they are, not even halfway. You should be there where they are. And that's exactly where technology comes in. I'm not saying technology is a replacement for something or technology is going to change the world or anything like that. What we're simply saying is technology is a platform. Use it like that. Technology is something which can get quality health information which has already been developed, or it's going to be developed using the exciting techniques we heard about today, and bring it to the patients in large volumes, to the masses, in real time and when they want it, not when you want to provide it. You can put it up over there, and when the patient wants to actually access it, the patient will be able to access it. You've got cool devices today. You've got smartphones, you've got tablets, you've got the internet, you've got everything available. And all these can be used to deliver health education. Yes, we talk about the pros and cons of Dr. Google, but Dr. Google is not a doctor. You are calling him a doctor. Google is simply a platform where doctors can put up the information, the same information that they're providing in leaflets. Because of technology, more than one technique besides the written text can be made available for patients to access. You can have audio, you can have video, you can have all this multimedia stuff, you can have games, you can have interactive text, okay? And we can go one level ahead now. This is where technology starts getting really cool. What you can do is you can deliver information to the patients tailored to their needs. I'm stress-filled individual, 34 years old, working really hard. There's a 20-year-old youngster who's carefree. There's a 65-year-old gentleman who is basically, enjoying the retired life. We all have different needs. And health literacy for all these people should be different. And technology can map this. Finally, I have to add something very cool. You can have, these things we were talking about, wellness assessments, you can have EHRs. All these can be actually used to take health literacy to another level, where you can actually not only be providing information tailored to the needs, but also tailored to the needs at a particular moment in care. You have a lot of different ways in which, health literacy can be provided. You have multiple paradigms. According to me, the best paradigm is using multiple paradigms together. That's it from me. Thank you.
Okay. Hi, can we have the panelists back on, please?